Welcome to the Evolve Podcast. Evolve your body, evolve your mind, evolve your soul, and evolve your tribe. And now, it's time to disrupt. And with that, folks, we want to welcome you to another episode of the Evolve Podcast. I am your host, Steve Cutler, and today we have a really unique episode, unlike any we've ever done before. Now, if you're watching this episode, you notice that I'm in a different spot. Now, I normally record the Evolve Podcast in my home studio, but today I'm sitting in my living room. So welcome to my living room. But I'm sitting here with three amazing women for a roundtable discussion. And before we get going, I want to give a shout out to our amazing AV setup master, Jake Thorup. Jake, thanks for putting everything together here for this phenomenal episode today. And as always, making everything sound great in post-production. The man himself, Traven Page, thank you for all the great work you're doing. Folks, today's episode, as I mentioned, will be different than our normal episode because we're having a roundtable discussion about brain injury, brain health, and how it plays into your overall health. For those of you that may question, why are we talking about a topic like this on the Evolve Podcast? I'd say there's a few reasons. First, as we discuss what a brain injury is, many of you will recall a time in your life where you experienced something that fits this definition. This episode can shed some light on this topic and expand your understanding. Second, there are 5.3 million individuals in the United States who are living with a permanent brain injury-related disability. That's 1 in every 60 people in the U.S. When I read that, that was absolutely astounding to me. Third, in addition to the 5.3 million with a traumatic brain injury, there are at least 2.8 million Americans that sustain traumatic brain injuries every year in the U.S. So if you don't have a brain injury, you probably know someone who does. Finally, the reason we're doing this episode is because I fundamentally believe that if there's a topic that I don't know something about, I want to learn more. Education and awareness open up the mind towards personal growth and evolution, and I've got a passion for learning and for sharing that with you. Now, I'm really fortunate in my life to have many amazing and interesting people who spark ideas constantly. One of our guests, Ashley Iverson, was on an episode with us a while back, and after we recorded, we stayed on and chatted for quite a while about another opportunity to dig deeper into this particular subject. As we brainstormed, we thought it would be fascinating to have a colleague of hers, Dr. Fong, to come on. And Ashley and Dr. Fong sit on a couple of boards together for brain injury awareness. And then something sparked, and I thought about my good friend, Jen, who has suffered from a traumatic brain injury. And I thought what a cool idea it would be to have everybody sit around the table together and discuss this particular subject. So with that, I want to go around the room and introduce our guests to you and have them tell you, our listeners, a little bit about themselves. Now, making her third appearance on the Evolve Podcast, Jen, I think this is a record.
Oh, wow.
You can listen to her first episode where she gave the background and actually tells a great detailed story of what it was like to suffer from this traumatic brain injury in episode 19. And then she was back on in episode 61 for a powerful episode that still sits in the top 10 most downloaded episodes that we've had on the Evolve Podcast, where she talks about abuse and sexual trauma. Welcome back, my good friend, Jen Salerno.
Thanks for having me back.
Thanks for coming back from this horrible situation of living in Costa Rica to the land of promise in Utah to do the Evolve Podcast. I know you flew back just for us, right?
Only for this.
Thank you.
That is the only reason I came back.
Jen, for people who maybe haven't listened to the previous episode, don't know you, can you give them a rundown of who you are and what you do?
Yeah, well, first listen to the other episodes, right? But who I am, that's a pretty grand question.
We're going to go metaphysical here.
Right? But we'll go with what I do. I actually run yoga teacher trainings is one thing I do, and that's partially why I'm still in this state. Helping a studio develop the program, and they're going to run it from this point on. And then I actually run a quantum mindset course, and I work one-on-one with individuals to kind of help them move through trauma and dig deep into their internal self so they can heal. and begin to live life fully. And I do that because I had to heal from a lot of things, from abuse and from a brain injury, and created a life that honestly, as I was just saying before we began, like I absolutely love where I am in my life, and it all stems from everything I teach. So I wholeheartedly believe in what I do, and I'm really grateful to be here to share it.
I think there's a lot of power too. When people teach something that they actually live, there's weight and power that comes behind it. You know, for our listeners that didn't hear the conversation before the recording started, I was telling Jen how jealous I am of the fact that she just flew in from her home in Costa Rica, and the pictures, the videos, I mean, you and your kids driving in a Jeep with the surfboards, it's just, what a life. So
Yeah.
you're actually living what you teach, and that there's a lot of power to that.
I think it's interesting because most people believe that there's, you know, maybe later or I'll wait for this. And I think there's that misconception that you're supposed to live your life fully right now. Like, why wait?
One of my favorite songs, Tomorrow Never Comes.
Right.
Yeah.
Yeah.
Well, Jen, thanks for joining us. Well, making her second appearance on the Evolve podcast, you can listen to the episode that we did with her on yoga-based therapy for recovery and addiction in episode 73. Welcome back, Ashley Iverson.
Thank you so much.
It's great to have you here. And this whole idea, the genesis of it came from you. So I've got to give you some credit here. Always been fascinated by our conversations and different angles that you bring to really any conversation that we have. And this was something when you and I talked about this, you said, hey, I sit on this board. I know Dr. Fong. This would be a really fascinating topic. And then we just kept brainstorming, and Jen got brought into it without even knowing it. We already committed you.
I mean, I love that.
I mean, I sent you
Here
the
for
text
it.
message saying we want you to come, but we'd already planned you being here, right? So anyway, Ashley, thanks for coming on. Tell our listeners a little bit about you and what you do.
Yeah, so I'm a part of the Brain Injury Alliance of Utah. As Dr. Fong will discuss, we're a nonprofit that tries to connect brain injury survivors in the state of Utah with resources to aid in recovery and support. I also developed a yoga-based therapy program that is currently used inpatient in psychiatric care. So my array of populations that I get to work with, particularly in this moment, I'm specializing in active duty military, inpatient seeking PTSD, substance abuse, sexual victimization treatment. I also work with Dr. Fong at her clinic, Cognitive FX, working with patients of concussion and head trauma. So all things mental illness and brain injury related, yes.
Yeah, fascinating. And it's, I'm really excited to talk about this topic tonight because I think that there's a lot of stigma around this, and we've got to break through the stigma. If we're going to understand and heal and come together as a world, we have to evolve into better human beings, right? Which means we have to start by understanding. So I love the crossover there, and I love the work that you're doing.
Thank you.
Finally, making her first appearance, hopefully not the last, but we'll see how this goes, right? Yeah.
Yes, has to work for both of us.
Yeah, exactly. Anyway, making her first appearance on the show is Dr. Alina Fong. Thank you for coming on. We are so excited to have you. And we already had a conversation earlier before we recorded that I was fascinated by. So I know our listeners are going to love hearing from you. Tell our listeners a little bit about you.
Sure, and honored to be here. Thank you so much. So my name, again, is Alina Fong, and I have a clinic in Provo, Utah, called Cognitive FX. We have another clinic in Provo also called Neural Effects, and we specialize in concussion patients as well as long hauler COVID and other types of traumatic brain injury.
Okay.
I also want to point out that what makes our clinic special is that we utilize a type of advanced neuroimaging called functional MRI.
Oh, yeah.
Yes.
I read about that.
Yeah, and it's a really fascinating technology that has allowed us to really see brain injury where other structural imaging looks so normal. And so we really tend to cater to these patients that are struggling so profoundly but are not getting the understanding by the healthcare community because a lot of their tests look normal, their imaging looks normal, and they are feeling a bit bereft, and a bit lost in that system. I like to address that there's several gaps with regards to traumatic brain injury, and one of these gaps is the gaps between science and what we're actually doing clinically with these brain injured patients. The other gap is this gap in care. It's almost as though once you reach this 3-month mark and you've had your injury, many clinicians will say, well, at this point, it might be psychological, and then they'll punt you along. And so, there's just so many considerations where we feel like there's a need for education and connection and just telling these patients that we got you, and you're not going to fall in that gap.
It's got to be extremely difficult to be in a situation where doctors look at you and they say you should be fine, you should be okay, so we're going to move you to the next space. And Jen, I know you're nodding because we've had this conversation before. I want to talk functional MRI, but before we do that, I want to reference something that you had mentioned before we started recording. You said that in working with vets that had returned, they look normal, right? And Jen, this is a conversation you and I have had where you said that, hey, I look normal, I look okay. So most people wouldn't look and say that there is a challenge, that that the brain injury manifestation and the symptoms and the challenges that they're dealing with, you can't see that from the external. It's got to play a massive weight on the emotions of people that deal with this brain injury. I'd love to hear both of your perspectives on it.
Go ahead.
Okay. Yes, it does play a massive, massive role, and it's honestly more harmful than I think most realize. Most clinicians and providers even realize. So there is almost this expectation, even from the patient, that, I look okay. Everyone says I'm okay. Maybe I should be okay. Now I feel crazy. Okay, so we get a lot of patients that will also, feel like just really misunderstood. But then you also have the misunderstanding of the clinician that says, well, yeah, you know what, your MRI looks fine, your CT looks fine, so maybe you are really fine, and I don't know what else to do with you. And it's really, really frustrating because you're not okay, right. And that you get up, brush your hair, brush your teeth, put your makeup on, head out the door to kind of cover up what's really going on, and you get through your day, but they don't see you come home and crash.
Right. Or crash in the middle of the day. I have a lot of those where it'll happen in the middle of the day, or I'll be running a training and all of a sudden my brain starts glitching and I'm like, well, here we go, downward spiral. Now it's just shutting off words I can't find anymore. Pain is arising. So, yeah.
Jen, talk about what that feels like to have other people tell you that you're okay, to have people look at you and think that everything's normal, but yet internally you're struggling with the healing process. You're struggling with the ramifications of the injury.
Yeah, I mean, I'm going to probably preface, for me it might be a little different because I've had that for a very long time where everyone just assumes that I'm fine. And so then you pack in this injury that happened 8 years ago, and I almost was kind of not shocked when the doctors were like, well, there's nothing else we can do. Hands off. See you later. And for people to not even realize, because I can still function, that they are like, yeah, you don't seem like anything's wrong with you. Or I'll be literally in the middle of something and I have to audibly tell people in a training that I'm hosting and being like, hold on, my brain's glitching, because I'll be misfiring over and over and over again. And I'm like, oh, geez, here we go. Shutdown's happening. Yeah. And then people just look at me, they're like, what does she mean? What is she talking about? Doesn't look like anything's going on. And I don't know if I would be the best to say how frustrating it is, maybe because I've dealt with being looked at as someone that's fine my majority of my life.
Right.
So I've kind of been conditioned to just being like, yeah, no, I know what's going on, and it's okay for me to know what's going on, and I'll just keep moving beyond that. I can't imagine what it'd be for someone that's new to being in this experience of having an injury like this, because it's almost something you can't explain that's going on inside your head.
Yeah.
And to be new to this and have peers and doctors look at you and be like, well, you're probably just losing your mind. It's fine. Go see a psychiatrist. That I can't even imagine being a first person, that first experience being looked at like that. That would be traumatizing. That would be an imprint that would be hard to move through.
Yeah, I can imagine. Actually, it makes me reminds me of some conversations that we've had about the opening up that several of the patients that you've worked with go through, and there's an initial guardedness, I guess, right? A defensiveness that they have when they come in because someone has told them that they're broken, but they don't know what it is. And as Dr. Fong said, maybe they're just crazy, right, in their mind.
Yeah.
And it's through this understanding and empathy that eventually gets them to open up. Can you talk a little bit about the power of empathy and the power of understanding in these situations?
Yeah, of course. Thank you. I mean, in my line of work, especially with active duty military, so many of them have brain injury and head trauma from their careers. And in the inpatient mental health setting, I think a lot of it's labels, right? We're trying to break the stigma. That's one of the reasons we're having this conversation right now. Right. Mental health in general comes with a stigma or a label that something's wrong. Yep. The first thing that I thought of when you brought up this topic in this particular moment is I have a really good friend that invests a lot in themselves. And he said to me one time, think of all the time and energy and money that people put into their appearance and going to the gym and even food that we eat, things that we do. Why is it labeled as something negative to put that much investment into your mind or your brain health, to have a therapist or to go inpatient if you're struggling in your life and receive that type of care? Why is it labeled as you're crazy or something's wrong with you? Right. So, in the intimate setting that I get to work in, as we discussed in that previous episode, upon admission, they are just completely wrapped up and pulled away. They're in this element of, and they say it to me, my patients will say, I'm in a mental hospital, and why is that a bad thing? And I always tell them, I'm like, I've been here for 10 years. So I'm like, I'm just getting
the free.
They haven't let you
out yet.
No. But to practice with empathy, I think healthcare providers in general, we go into that industry and that field because we intrinsically care about helping someone else. Right. And so that biggest factor of showing up that way, if we as a society could practice awareness, empathy, and taking away these labels or the stigma and exposing an invisible injury such as a brain injury, like that's what we're doing right now, is trying to change that narrative, right, through information. Yeah,
information really opens up the door. If people are aware of it, then they can start to take care of it. I think it was Chris Tompkins, who was married to Doug Tompkins, and Chris and Doug bought I don't even know how many acres of land in the Patagonia region of Argentina. And the reason they did that was they wanted to preserve the land. And so one of the first things that they did was create paths for people to be able to hike through. Because Chris had a belief that as soon as you understand something and you can observe it, you will then love it, and then you will take care of it. And I think that understanding starts with being open to a different point of view. We label things like crazy. We label things like mental hospital. There's a negative connotation to that, but we have to break through those things, and I think that we start to do that through understanding. Dr. Fong, I want to hear from you. How do we break through that? How do we create this awareness? How do we create this understanding so that these negative connotations don't continue to be our path?
Well, I think one of the first things that we need to do is demystify the prevalence of traumatic brain injury, which you did. When you spit out these stats and you realize, oh my goodness, 1 out of every 60 people, and it's actually more than that, right? You start realizing that everybody that you talk to says, oh my gosh, I had a brain injury. My son had one. My neighbor had one. My sister's husband had one. And the more you start talking about it, the more you realize that this happens much more often than you think. I think that I actually had my first interactions with concussion while I did my internship at the VA hospital right here in Salt Lake City. And it was as I was finishing up my doctoral program, and it was right in 2007 and 2008, which, if we can remember back, that was right during the Iraq and Afghanistan war. Right. And concussions were the signature injury of that war. And the reason why is because our technology had advanced to the point where we were our gear and our armor was protecting us, protecting these soldiers, whereas before they would have perished. But now they're coming home intact. But nothing can prevent that brain from shaking inside the skull with all the RPG and IED and all the IEDs and explosions. And so they're coming back looking normal, but having concussion after concussion after concussion. So that war, I think, really brought awareness of concussion to the front stage.
Yeah.
Now that, along with this big NFL lawsuit, right, that happened.
Right.
So I think that really is helping kind of break down this stigma. The other thing is that there was this, it was this one study that was done, and it gets quoted all the time, and it's actually not correct, that said that a vast majority of concussions will improve on their own within 3 months, and after that, it's no longer concussion. And that just angers me so much because it's just so wrong. They were labeled the miserable minority. And that can absolutely put a stigma on you, right?
Absolutely.
If you're like, well, wait a second, I still have symptoms. I'm 3 months out. I'm the miserable minority.
So then you just start to make these ties to everything else. If I'm part of the miserable minority, what else am I, right? What is wrong with me?
Yeah.
There's got to be this spider web of negativity that we're conditioned to see negative, right?
Oh, yeah.
And so we're going to see negative in our life and say, well, it's probably because of this. It's probably because of that. And, I do this thing wrong. And it's all these normal things, but you throw a label on that. Now we're spider webbing out to all the negative.
Well, and you put those glasses on, and that's all you see.
That's your paradigm, right?
But one of the biggest things that I do to try to help these patients get out of that there's a wonderful study, and it's called the Evolve study, actually.
That's a best name for a study, right?
And this is a
Amen
study
to that.
that was conducted by a researcher at
I
the
almost feel
University
like we
of
got to do a
Washington.
hallelujah. Or something, right?
Girl, how accurate is that study? Must be
I
accurate.
know, didn't even plan for it, but it's one that I quote all the time because this, like I said, this was a study done by researchers at the University of Washington, and they actually started this study in 2008, and they were following vets a year, 5 years, 10 years post their initial concussions. And this study is blowing all those other studies out of the water because they're actually doing a longitudinal study, and they're finding that not the miserable minority, but actually 80% or more.
Wow.
80% or more of these subjects, 5 years post their injury, 5 years now, are still not at their baseline.
Wow.
And the evolution piece comes with their realization in their study that the symptoms never really resolved, they just evolved. And at the 5-year mark, there's some difficulty with discerning whether it is depression, PTSD, anxiety versus the traumatic brain injury. It all just becomes one ball of difficulty and symptoms and issues. And that's what happens when we don't get the proper care. So blowing these stigmas out of the water requires good research and getting that information out to the community and telling people it's going to be okay.
And going to the study that you were talking about earlier, I watch the news from time to time and just want to scratch my eyeballs out because they cite studies so often that are so incorrect. And if you actually go read the study, what they report on is not what the study says, but it creates a headline.
Well, fear.
So, and it's all fear-based, and it creates this narrative that is completely incorrect. I mean, I had a client recently that brought in a study, and it was basically, it was just a news headline. It said, well, this is what I should be doing in my life. I said, that's completely incorrect. Let's pull up the study. We pulled it up on PubMed. I showed what was happening in there, and they said, oh, well, why did the news report that? It's because it gets headlines. But that's what's being indoctrinated, right? And so if we're going to break through the stigmas, we've got to stop believing some of these studies, right? That things, 3 months later, you're good. That's not the case.
No.
That things evolve. Jen, you're 8 years out from your traumatic brain injury. talk about that evolution. What was it like at the beginning versus what it's like now?
I was miserable in the beginning. I vaguely remember them saying I had a stage 4 concussion, and then also with the fractured skull and bleeding in my brain. So I had like this combination of, it was horrible. My eyesight, my eyes were like twitching back and forth, couldn't even see peripheral. I had couldn't speak either. My words were all jumbled and couldn't, like if it was a red truck, there's no way I could describe a red truck. It was the most bizarre thing, and you just get frustrated.
Yeah.
And I had like the 0 to 60 of like, okay, and then I was like a monster essentially, like just pissed off and angry and couldn't keep my emotions intact. It was out of control. And then you fast forward down the road, it's now it's more along the lines of, I still notice the emotional piece of it, and I notice, but it's not the same. I mean, obviously I do a lot of meditation, I do a lot of inward work and things like that. So I definitely believe that's a lot of the help that I have as far as not allowing it to take over. But I do notice that I find myself in spaces where I'll get really low or angry, and it's unexplainable sometimes. However, I'm understanding, I know what it is, but I do notice that piece shows up. And then again, the loss of words, or my brain, I just call it like the shutdown. It's kind of how I explain it. I'm like, oh, there it is. I'm shutting down now. It's done.
Yeah.
It's done with me now. And then I get back to the point where I'm trying to find words again. And I also notice, and maybe you can speak to this, that being back here, so I obviously just came back, I'm struggling with my brain being here. I'm very tired. And I don't know if it's the pressure.
Oxygen.
Oh, there's so much. And that's a whole other podcast.
I'm like, oh my God.
Yeah.
And it's fascinating that we're
I was
talking
going to
about
say, I
this.
remember reading some studies about the difference in mental health and oxygen level, people living at high altitude versus low altitude.
Yeah, I do. I do fabulous in Costa Rica. I do amazing there, right? And then I came back here, and I'm like, all I want to do is sleep. I'm very like blah, and I was just noticing that that's what it was, and I was like, maybe it's the storm, because it is harder for me to find my words right now, and so I'm curious if that element has a lot to do with also playing into it, but still staying on track with evolution. It still is part of it, just not as intense as it was when it first started. Obviously, I can see, my peripheral works, I have more control over it, but I do notice those lows, and the anger is still very present, just different. Yeah.
It's interesting, those emotions. I think we tend to look at them as a negatively charged emotion. Not that they're bad, right?
Yeah.
But there's a negative and positive charge to different emotions.
Right.
Have you gotten to a point where you can look at those negatively charged emotions and just get to a point of better acceptance when those come up?
Yeah, honestly, you sit with your feels, right? Just be aware of what it is. And sometimes it's just like, okay, right now I feel this way. And allowing myself to be in that state rather than, oh, I cannot feel this, right? I've got to be happy-go-lucky 24/7. No, I'm aware that that's not what the case is. So just allowing myself to be with it and not beat myself up, which is why I appreciate you saying, like, get rid of the labels. Right? The labels are bullshit.
Yeah.
Yeah.
Well, and I think it's okay to recognize that there's a wide range of emotion, and whether it's a negatively charged or a positively charged emotion, that doesn't mean it's bad.
Yeah.
It just means there's a different energy to it.
Right, and if I don't let it rule the household.
Right.
Yeah. If
Because
I can,
choice is still there. Right?
Always, right? Those are the things we always control.
Yeah.
Yeah.
Actually, I know we talked about this in the episode that we did where you provide space. You hold space in your yoga teaching for people to feel what they're feeling and to be able to work through that on their own. If somebody's listening to this podcast right now, they're resonating with what Dr. Fong is talking about, they're resonating with what Jen's experience is, how do they sit in that emotion from your perspective? How do they sit in that pain, the torture that they're feeling, and choose to work through, choose to sit through and just let that pass?
Yeah, well, the first thing is it's a practice, right? It's
Not perfection.
It's not a one thing.
Yoga
Yeah, it's not a one-time thing. There is no perfection.
Practice,
Yeah.
and so it's that dedication and discipline, and losing that label or expectation that it's supposed to be easy, or even possible.
Yeah.
You just show up and you work through it. When I'm working with my population and I'm coaching them through these experiences, we get into a physical experience, and then it's about building an awareness of what's taking place. And so I like to give them that information package of all of this neurological conditioning, and the way that we've kind of trained ourselves through just life, that anytime we feel something that's not to our satisfaction, which you could term with the word suffering, right? Suffering is wanting something to be different than it is. So as soon as you have this experience of suffering, your brain kicks in that it's time to change it, hide it, fix it, fade it, erase it, run from it, give up on it. It's just this whole downward spiral that it's not acceptable. And so a big part of the yoga teachings is to build a relationship with that. That's how you remove the suffering. The suffering never disappears. It's just that what relationship can you build with whatever element is causing the suffering, so that the suffering becomes something different. It's not negative anymore. And so it's that practice. And obviously in yoga, there's a lot of different avenues to create it. One of them being with the physical body and the sensations and experiences that we go through. But anything physical has no option but to be emotional. Yeah. So, you know, when you sit in that experience, it's going to evolve. And the beautiful practice of awareness gives you the toolbox to build that relationship that serves you.
We feel the emotions in the body, right? It's not just a cognitive thing. We're feeling them through our body. And so I've been a big believer that if you're going to evolve into a more evolved man or woman, you need to be moving on a regular basis. That is your practice, because that's part of how we pass through these emotions, or let these emotions pass through us. Yeah. Because like you said earlier, Jen, you might feel that sense of anger, that maybe the brain is shutting down right now. Okay, well, we know it's going to turn back on. There's no, we don't need to get fearful or anxious.
Don't need to burn the house down.
Right. It's going to come back, right?
But with that, an emotion, a term or a label, vulnerability, openness, support, trust, whatever it is, you can take an emotion and you can exchange that word. But how do you experience it so that you have a relationship with it to understand it? Yes. And that's a big part of that practice of yoga is to, even something as simple as laying down on the floor and feeling your own skeletal muscle release because it feels the floor hold you. Yeah. That's the experience of trust, right? And so when you take someone that doesn't acknowledge that and can't find an avenue of coping with suffering, and then you get the opportunity to understand your own emotions, that's where you really start to build your toolbox.
Yeah. I love that. And I love how you're talking about that it's a relationship with your emotion. Yep. Because I think that's the key. And you have to change your relationship with whatever it is that you want to, if you want to get a different paradigm on it, right? Yeah, if you want to evolve past this blockage, you have to develop a different relationship with it. There was a study that I heard about recently, and I have not looked it up, so please don't quote me on this, but they looked at two different groups of people where they had one group look at a paint sample and said, okay, look at that paint sample and then explain it to us. So they did. And then another group look at the exact same paint sample. They didn't ask them to explain it, but they were just asked to look at it and feel it. The group that explained it, when they laid out, I don't know what it was, 5 or 7 different paint samples, could not pick out the paint sample that they had originally looked at. They had created labels to describe that. Now, I think the study showed that it was about 30%, somewhere in the 30% range. The group that didn't have to explain with words what the paint sample was, over 70% were able to identify the paint sample. I thought that's fascinating, because far too often we create these labels. The labels create these blockages that we're just not able to move through. So creating a different relationship with the pain, creating a different relationship with the challenge, what a powerful tool.
I'd say creating a different relationship with the understanding, like brain injury, that, to change that stigma and label. That's exactly what we're trying to do, is create a different relationship with what is that.
Yeah. Dr. Funk, talk about, I want to make sure that our listeners really understand, what is a brain injury? Because if we're going to change it, we have to define it. We have to understand it first. What is a brain injury?
So a brain injury is an event that occurs that could be acquired or non-acquired. It can happen at birth. It could happen to you through a traumatic event. You could have a slip or a fall or motor
So you're
vehicle
saying
accident.
when I was born, my mom had a brain injury. She looked at me. She's like,
It was
"Not
when
that
she
one."
dropped you on your head. That's when that
Multiple times. Yeah.
So there are many different definitions of brain injury and different categories and different labels of it.
Oh, the brain's complex.
Yes, really. Mhm. Yeah,
no,
it's
we
not
know
just
what
a
you're
regular
talking
muscle.
Yeah.
Yes, yeah. And what makes it difficult is that, you can have what we call a mild traumatic brain injury. So there's different gradients, like an MTBI, a moderate, a severe.
I sort of laugh at that, but mild and traumatic together in the same sentence.
Yep.
It's like saying, hey, this it tastes like garbage, but it's really good.
Yeah, and it's hard because they try to kind of categorize a concussion versus a traumatic brain injury where you have a skull fracture or we have to remove part of your brain or you require neurosurgery and now you require a shunt or, and in fact, Jen, if I'm being honest, your brain injury with a skull fracture and a bleed, I would not have said was a concussion. I think yours would have been more of a moderate traumatic brain injury.
Well, yeah, but my whole story is crazy if you really dive into what happened with this whole thing.
Yeah.
But they first classified me stage 4 concussion. And then after I went to my second neurosurgeon, then she was like, no, you have traumatic brain injury.
Yep, exactly.
Which is, it still blows me away to this day, because when you tell people or when people are told the story of what happened, that you literally fell directly on your head from the yoga silk, and how far?
Jeez.
Well, we don't know, but they said maybe 4.5 feet, maybe more.
Oh,
but just
With that force, yeah.
on cement.
Wow.
Yes. So to go back, a brain injury can even be a stroke, right?
Oh, yeah.
It could be neurotoxicity. It could be carbon monoxide poisoning. It could be. It really is.
COVID.
Oh, yes, COVID. Yeah, in fact, I did a few consults just for COVID this morning. And so people ask me, well, what is the definition of a concussion then, right? Because a concussion is still a brain injury. And in fact, the term mild traumatic brain injury is what concussion is synonymous with.
Okay.
So when you see the term mild traumatic brain injury, I know you laugh. It seems like, an oxymoron.
Right.
But it's just a way to categorize a concussion where you don't have a bleed or you don't have a skull fracture, but there was still, we know now enough to know that there was a shaking of the brain enough. It comes from the Latin root to shake.
Okay.
Yeah, to shake violently.
So how do people know if they've had a brain injury?
Well, if you've had a more moderate or severe TBI, you'd know because your doctors will tell you that. But and here's what's crazy, is a lot of the stats that we have about concussions that happen are grossly underestimated because most people don't even go to the doctor for their concussion.
Okay.
That's true.
Right?
Yeah.
One of the other misunderstandings is that you have to have a loss of consciousness. And in actuality, 90+% of concussions do not have a loss of consciousness.
Really?
Yes.
Wow.
So if you're using that as your litmus test, you're going to be wrong 90% of the time.
So I remember hearing as a kid, if you didn't fall asleep or you didn't pass out,
Or
then
throw
you're
up.
probably good. Or
Right? That was the other one.
Then you're okay.
Yeah.
You didn't have a concussion.
Yeah, not true.
Right?
Not true.
Wow.
So now, so the symptoms that people actually most associate with concussions are not loss of consciousness, it's not nausea, it's not vomiting right there on the site. It's usually confusion, disorientation. Okay, so not loss of consciousness, but when you're like, wait, what happened? Where am I? Or you might be kind of repeating the same kind of questions over and over.
Yeah.
And then you have more of this. There's a lot of people that might have some headaches or feel a little dizzy. And so if that's what you're feeling and you're waiting for these big ones that, are more like in cartoons, right?
Yeah. The anvil dropping.
The anvil
over your
dropping,
head,
and then it drops again and you're fine, right?
Right.
You're probably missing your concussion.
Wow.
By the time they come to me, the main symptoms are I can't focus. I can't find the right word anymore. I can't do school. I can't read. My eyes. I see double vision, light sensitivity, noise sensitivity, cognitive issues. And then if they're further along, and we can, again, a whole other podcast about that, but they can start to have sleep problems. Then their brain goes into what we call dysautonomia. So there's disruption in the autonomic nervous system.
Wow.
That
Okay.
makes sense.
Yeah, and an imbalance between your sympathetic and your parasympathetic
makes
nervous
total
system.
sense. Yep.
You know, and then you start feeling more panicky. You feel like you're in fight or flight all the time. And then how does that not affect you psychologically? You start having emotional issues. So there's this evolution and this cascade of symptoms the longer these symptoms go unchecked. So I've had so many cases where they'll come to me, they'll tell me their story, but they don't ever connect their issues with a concussion that happened maybe a decade ago.
For sure.
Yes, fascinating. So
Yeah.
that difference between the sympathetic and the parasympathetic, if that is happening, you could be in a totally what we would consider parasympathetic type of state, right? Zen, relaxed. But if that is happening right there, you're going to be experiencing
The opposite.
anxiety, right?
The
You're going
exact
to be experiencing something that is
opposite.
going to shoot your catecholamines to the roof.
That's
right?
exactly right, you know? And in fact, I have so many patients that are misdiagnosed as with panic disorder or you know, I didn't have anxiety, now I have anxiety and I'm on all these medications and they're not helping.
Yeah.
But what it really is an overactive, unbalanced sympathetic process where the body is not, the sympathetic nervous system is not being allowed to come and calm everything down.
Interesting.
But I have to kind of couch this in a way where your brain is actually doing what it thinks it needs to do, which is survival.
Yeah.
Right.
Yeah.
You know, but the problem is it's been injured so long that it's interpreting anything as a threat to your system. So, for example, one of the biggest symptoms in one of my in my more chronic PCS or post-concussion symptom patients is exercise intolerance. So they start
Okay.
exercising, but once they reach a certain like a heart rate level, symptoms start coming.
Yep.
And what's happening, in a very simplistic sense, is that the brain is recognizing that your heart rate's going up, but instead of going, oh, I'm exercising, it's going, oh, why is my heart rate up? Are we running from that bear? It's that bear, right? Yeah,
Wow.
let's go. And you can only maintain that level of heightened vigilance and, survival for a short period of time, and then you just crash.
Yeah, because it's going to dump all of the adrenaline, right?
Yep.
You're going to get all of the spike of your catecholamines. You're going to have insulin all over the place. It's going to dump a ton of sugar into you and just say, all right, ready to run, ready to save ourselves.
Yep.
Then what, right?
And then you
I mean,
crash.
yeah,
You
you
crash
crash.
And the problem
Wow.
is when you have a brain injury, you do not have the normal amount of reserves
Right.
of all of that.
Yep.
And so you start, your roller coaster is like this versus most of us are like
Dude,
this.
the roller coaster is gnarly, too. Yeah.
I love how you're over here like, yeah, that's me.
I'm just like, well, it's awesome to hear somebody explain it because I'm like, oh, yeah, for 100%, that's exactly what I'm feeling. Yeah.
So have you experienced that dysregulation, that
Oh, yeah.
like where maybe the anxiety goes up or your exercise? Talk
Yeah,
a
and even
little
not
bit
just
about
even when
that.
you're exercising, but when, like, just recently was facing something, going through something, I noticed that I was not able to regulate my system. Like, and I teach people how to regulate their nervous system, and I was like, okay, I'm having a really hard time right now regulating my own nervous system, and I was in fight or flight for way too long, that my nerves were on edge, and I was like, oh my God, this is not okay, like, this is not good. So, but listening to you explain it is awesome for someone like me that's like, yeah, I totally, that's where I am. Yeah, and that's why even my workouts have changed. And now it's also fascinating because I absolutely love free diving, and that keeps your system in such a state of calm that I think that's partially why I'm like, this is the best thing on the planet.
Wow.
Yeah.
It almost
Interesting.
forces.
Yep.
Forces
It's
that
like this
state.
big hug, a blanket of being like, oh, you're in the best state right now. We're just going to keep you super calm. So you just like to stay nice and deep. Yeah.
How have you changed your workouts? Talk about that.
I'm not as intense with my workouts at all anymore.
Okay.
At all. Yeah.
Because you used to,
was
our
crazy.
listeners probably don't know this, but you used to sprint
Yeah.
when you were younger, right? You were a track athlete.
Yeah.
You'd lift weights on a regular basis. I mean, I think that's one of the first few conversations that you and I ever had
Yeah.
is about sprinting and strength training.
Yeah.
And so have you cut that out?
Yeah, I mean, I'll do like kettlebells and stuff, but won't see me do anything gnarly, nothing nuts.
Interesting.
Yeah,
Okay.
not anymore. And I kept trying to like bring myself back to work out the way I used to work out.
Yeah.
And I would notice exactly what she's talking about. The reserves weren't there, so I would crash, and it takes me longer to get back into flowing normal, right? Quote unquote.
So I think it's important for our listeners to understand that the brain regulates the entire nervous system, right? The
Everything.
Everything.
Right?
I mean-
It is the literally, quote unquote, the head of the nervous system. And so
Yeah.
the nervous system, then when we talk about energy and how energy gets through the body, how it crosses over into cells and how it functions in daily life, exercise, it is everything, right?
How you breathe,
Yeah.
breathing, heart
Yeah.
rate, blood pressure, temperature regulation.
Yeah.
And whenever I get
interesting.
a woman in that's about my age, I'm not going to say how old I am, and they start bringing these things
You already
up.
said it earlier. You're 22. It's okay.
Yeah.
Thank you.
Thank you. My 17-year-old would disagree. I'd be like the youngest mom ever. No, but they end up going to their gynecologist, so they go endocrine, and it starts getting blamed on things like, oh, well, you're menopausal.
Yeah.
And it's like, well, wait a second, there's that little pituitary that's sitting out there in that brain that can be injured. And then, of course, there's the whole endocrine system. And then there's the autonomic nervous system that can control these things. And so, again, you're put on medications for things. And
Yeah.
again, this brain is the root of pretty much every conscious thought and every regulatory system.
Right.
Yeah.
That you are. I had a professor once explain it that all a person actually is your brain and your spinal column, your nerves, and everything else is parts and casing to support that.
Yeah.
Yeah.
And it's
Yeah.
interesting when
Yeah.
you
It's
look
true,
at that
though.
and
Yeah.
consider. And I imagine this on a daily basis. Truly, like
Yeah.
I just imagine everyone's brains. Like everything else is parts and casing.
Yeah.
Yeah.
But it's true. Everything comes from that. And so that's got to be extremely difficult. I guess where my mind goes is once we're aware of this and once we understand that these are the symptoms, how does a person look at this and say, okay, it's not because I'm in menopause. My regulation or temperature regulation might be coming from a traumatic brain injury. If someone's listening to this episode and they are kind of like Jen was just doing, she's like, yep, I got it. If they're doing that, what do they need to do? What are the questions that they need to ask? Where do they go?
Go to you.
Well, thank you, Steve. I'd like you to come on down.
Sponsored by Cognitive Effects. No, it really wasn't. I think this is a great segue to talk about functional MRI. Should we talk about
Let's do
advanced
that.
neuroimaging?
Yeah, I'm fascinated. When you said that, I was like, whoa.
Yeah. Okay, let's
This
talk.
is something that
Yeah.
so I'm a nerd. I love just reading random stuff. And if
Yeah.
I see something, I'll dive deep into it. But I'm obviously not an expert. So I would love to get your perspective. Tell our listeners about functional MRI and what this is. This
Okay.
just blows my mind. It's one of my favorite topics right now.
Me too.
Yeah.
Really. And I'm so passionate about it, and I hope I can convey some of that. So, functional MRI is very different from structural MRI. So I think most of your listeners have gotten an MRI before, know someone who's gotten a regular structural MRI.
Yep.
And what we're looking for there, structural MRI of the brain, is just for any gross abnormalities. We want to make sure there's no skull fractures, or there's no tumors, or there's other things like that that might be explaining why a patient might be having these ongoing headaches or having these ongoing symptoms, right? And so usually if you're 8 years out, right, Jen, they would do an MRI. They would just make sure that everything's okay. But for these concussion patients, one of the diagnostic criteria of a concussion is a normal MRI.
Really?
Yes. So for you to be diagnosed with a concussion, your MRI should look normal.
Okay.
Because if there's something else there, then it's obviously not just a
So again,
concussion,
if
right?
my mom dropped me on the head, I'd still probably look normal.
Yes, probably. Honestly, just
I might
because.
just grow curly hair like I did. But
And yes. But yeah, because when you get injured that young, a lot of the time the brain has a lot of that neuroplasticity and that neurogenesis, and it can still develop and look structurally normal.
I just got to tell, like, my mom didn't drop me in. Not that I know of. So, Mom, if you're listening to this is not a bus throw. Anyway.
Okay, but functional MRI is a very different way to look at the brain, because I already assume that you're structurally normal. In fact, we're going to do a structural MRI when we do the functional. But functional is your ability to do cognitive tasks, brain games, neuropsychological assessments when you're in an MRI machine.
Okay, I want to do this.
Yeah. So instead of just
That'd be
lying
fascinating
there,
to see what's
right,
going on.
and doing nothing,
Yeah.
I'm having you do problem solving,
Yep.
memory tasks.
Please, for the love, I need that.
Jen's like, sign me up.
Yeah.
Yes, word finding, multitasking, and I can see how the brain is activating and how different structures are communicating with other structures in your brain.
So you can see the firing that's happening in real
that
time.
is what I'm
This is
doing.
what fascinates me.
Yeah,
This
that
is just
is
awesome.
fascinating.
Right?
Yeah.
And so this is how I know if someone has a brain that is injured, even though it looks so normal and even though you look so normal on the outside,
Yeah.
because this can show me what it costs you
Yeah.
to do what you need to do. I can show you which parts of your brain are hypoactivating, not firing like it should, or the analogy I like to use is you're running on fumes.
Yeah, I get that one.
Yeah.
Conversely, you're going to have some parts of your brain that are now overcompensating and hyperactivating and gas guzzling and what we call intracerebral steal. So stealing some of those energy metabolites away from other areas. And your brain did that as a way to rewire and to adapt to your injury. But as brilliant and as amazing as our brains are, sometimes our brains are dumb.
Yeah.
Okay? And even though now it's 8 years post your injury, Jen, and your brain is not technically swollen anymore, and it will not reroute to the efficient ways without proper therapy and proper treatment. Now, the beauty of fMRI, and I just want to be clear, I don't use this to diagnose. I don't need it to diagnose. Most of the patients that come to me already have a diagnosis because they've been struggling forever. But what I use it for is to guide my treatment and then to track treatment recovery.
Okay.
So we will scan you before treatment, identify which areas you need to work on, and then scan you during treatment or even after treatment to make sure that we are targeting the areas and those areas are neurally changing and that plasticity window is being open and we're tinkering around in there and we are making these real changes.
Yeah.
So that is the beauty of advanced neuroimaging.
It's so fascinating to me. There's a lot of crossover in the space that I have been playing in for the last 20 plus years where, I deal with a lot of people that would come to me injured or they've had surgery or whatever, right? Hip, they've injured their knee. The body's an amazing thing because it'll adapt to keep us going. There's a survival piece that kicks in. And if we have replaced a knee or a hip, that person goes to physical therapy and then they come and see me because it's still not working. In fact, I had a guy walk into my office the other day and say, my knee's doing this. I'm like, that's not normal. Let's fix that. So the body will adapt, but that doesn't mean that the firing pattern and the proper movement and that coordinated movement will happen, right? So it's this, my understanding, if I'm hearing you right and what I've read, is that through this functional MRI, you're able to identify where things are overactive, where things are underactive. Then you can create a treatment plan to say, nope, that's not right. We need to turn the nozzle down here a little bit. We need to up-regulate that a little bit more.
That's exactly right. We can identify where the compensation is occurring because, as you know, that adaptation, as a physical therapist, right? I mean, who works with this, and as athletic trainers, we have PTs, we have ATCs at our clinic as well.
Yeah.
You can see how the body compensates.
Yeah.
Right? But compensation's not healing.
No.
And what worries me is a lot
It's
of
just
people,
survival.
it's survival.
Yeah.
But people will say, "Oh, I'm doing okay. I'm fine. But they
I've
don't
got
realize
no pain, right? Because your body moves out of pain. It'll move away from pain. That's how it survives.
Yeah, but the long-term effects of
Yes.
that?
Yep.
Huge.
Exactly.
Huge issues. Yeah.
Yep. And so my whole purpose, the whole reason I think that I was here doing what I'm doing is to bring more awareness to brain injury, but to show people that there's hope and that there's ways to change it. Because, when you are struggling for years or months and you've tried every med and nothing works, people feel very alone. They feel very hopeless.
Yeah.
How would you not be depressed or anxious?
Right.
And so most of the time...
Or suicidal.
Or suicidal,
Yeah.
yes. And I have to screen for that with every consultation I do. But most of my job is just kind of giving them some hope again.
Yeah.
And validating their experience.
Yeah.
Well, and I actually love that you brought up the suicidal piece because that is, the stats on suicide are just heartbreaking. The last 5 years, even pre-pandemic, we were on a hockey stick
Yeah.
right? We're on a J curve that is just going straight up. You throw the stress of the pandemic, the stress of the financial, some economic downturns. You throw all of this other stress on a person that has a traumatic brain injury,
Yeah.
and they can't regulate. They don't even have hope that this is something that they can heal from. And we're just losing far too many good people in this world. Like, I've experienced this with friends, with colleagues, that I'm frankly just sick of losing people. And so I love what you're talking about, that there is hope here, because I'm tired of losing people in my life. I don't want to lose people because they feel like there's no hope anymore. When you've done the MRI, you've got to the point where you understand what's going on. What are the next steps? How do you get people into a treatment plan to get them moving forward?
So, by the time patients reach out to me, and I say this with no ire, I'm never their first resort, right? I'm always their last resort. You know, in fact, we did some statistics, and 80% of our patients come not just from outside of our state, but from outside of our country as well. 10%,
Really? Wow.
Literally 10% of our patients come from Europe.
Wow.
Wow.
Yep. Then we have others that come from Canada. We have some from Israel. We have some from Asia, all over the world. Because again, we're the only ones that do what we do. And if we think we're behind here, Europe is actually further behind us in understanding concussions.
Wow.
And when you take into account more socialized health care, they don't have access the same way that we have access, to this. And so by the time someone comes to me or does a consultation or seeks me out, they are kind of at their wit's end and they're ready to try pretty much anything, okay? And so we do their scan. They're in my clinic for 2 weeks. It is a 1 to 2 week program, but most of the patients stay for 2 weeks.
Okay.
And it's a boot camp almost. I mean, they're there from like 9 to 5, sometimes, 9 to 6 if they're doing yoga with Ashley at my clinic. But every hour on the hour, they're doing individual one-on-one therapies with PT. We have physical therapists, neuromuscular therapists, athletic trainers, occupational therapists, cognitive therapists, speech-language pathologists, vision therapists, vestibular, sensory motor, neurosensory integration, clinical psychologists, on and on and on. But every licensed therapist understands fMRI, they understand neuroplasticity, they understand how their own toolbox can help treat that individual patient and their individual symptoms. So it's a very intensive program where no one is siloed. Everyone is talking together. And so that's how they come. They come and they sign up for a 2-week program where we scan them periodically throughout their stay. And then, of course, we send them home because they can't live here, though many of them want to, and after this. But we do an active post-care program with them. We help follow them after their treatment with us.
Wow. So essentially, every person is getting treatment based on what their needs are, and that could come from 3, 4, 5 different therapists, depending on what they need, right?
55 different therapists.
55.
Yes,
Wow.
yes, in like over a dozen different disciplines.
Wow.
Yeah, it's
That
a
is
really special
fascinating.
place. Yes, yeah.
That is fascinating. I mean, there's got to be a lot of hope that's being created with this. When people come in, if you're the last resort and they already feel a sense of maybe I'm crazy or, I'm not sure what's wrong with me, like talk about that, the hope that's being created.
It's a magical environment. It really
Actually,
is.
you speak to that because
I
no,
can't.
really, because in fact, Ashley is a rather kind of new add-on. I wanted her for a while, but she's a new add-on because we've wanted something at the end of the day to help these patients kind of close out their day. They're worked so hard. Can you imagine 8 hours of therapy a day? And many of these people, this is the most activity they've done since their head injury, right? Sometimes years, decades. And so it's a very supportive space. We take very good care in hiring the right people there as well that understand brain injury, have that empathy that's just kind of I think you're kind of born with it.
Yeah.
You know what I
Yeah.
mean? Really, you
Right.
can't force it. You can't really train it. We've
Right.
realized.
Yeah.
But yeah, it is just a place where, because we understand it, there is that hope, and there is we're very well known in probably one of the smallest countries in Europe, but one of the most powerful, I think, which is the Netherlands.
Okay.
And in fact, I'm heading
Interesting.
out there. I go out to the Netherlands several times a year. So when I said about a tenth of our patients come from Europe, about 90% of them come from the Netherlands.
Okay.
Yeah.
Interesting.
Yeah. But when you think about it, it's a land of bicycles and no helmets.
Yes.
There
Makes
we go.
sense.
Okay.
You know,
All right.
but some of the most wonderful, some of the kindest people, but they are very realistic. And so, you know, they think Americans we use the word amazing and awesome, and they just tease us all the time because they're like, not everything's that amazing.
I guess
Yeah.
it
Like, yes, it is.
it is amazing.
Yeah, in America, it is.
Haven't you seen me? Haven't you listened to me? Of course I am.
Everything's amazing.
Yes.
But yeah, they joke about that all the time. But when I sit and do a consult with them, and I'm the first one that's actually taken them seriously, their healthcare system is a little different as well. They kind of have a gatekeeper, like a GP, a general practitioner is a gatekeeper. And once you pass them, if that gatekeeper labels you as something, that follows you everywhere.
Ooh.
Yeah.
Interesting.
No, it's a very interesting system. But
that doesn't sound good.
yeah.
Yeah,
No, you know,
right?
'cause like for
I
us,
don't like that.
for us, we're like, I don't like you. I'm going to go to another doctor.
Yeah.
Like,
Yeah.
They don't really do that.
Second opinion.
Yeah.
Yeah.
Third, fourth opinion, right?
Yeah.
They don't really do that there, you
Yeah,
know? So a lot of that is just instilling that hope for the first time,
Yeah.
you know?
Or
with
offering
these
them a
patients.
voice. I think
Yes.
that's a huge element. And even something as far as brain injury, offering a voice, because it is that invisible injury. And then you tell yourself to move on and that you're normal and you're
Yeah.
fine. So yeah, having a voice is an essential element.
Yeah, I can imagine. Which holding that space for another person, especially as they've gone through the hard work, the difficult challenges, and as you said, they're probably more active during that time than they have been in a long time. Just having that place where you hold space for them, wherever they are at, that's a healing thing, right?
Yeah.
People accepting you for where you are, you accepting yourself where you're at. That creates a bedrock of growth.
I
Right?
definitely is the latter of what you just said, accepting you for where you're at.
Yeah.
Rather than beating yourself up or wondering why, right?
Yeah, there was we did an episode couple of months back with a Buddhist monk, and he taught me the phrase "Namu Amida Butsu," and it's essentially just come as you are, wherever you're at. Come as you are. You feel happy, you feel sad, whatever it is, show up, because when you come in your most authentic way, you then can build, grow, heal, progress, and that acceptance piece, I think, is critical.
Yeah.
Jen, talk about that as you have gone through this. You're 8 years out. There had to have been a point where you had to get to where you say, I accept where I am and I can heal and move forward. But I would imagine that wouldn't be an easy thing.
No, for sure it wasn't. I mean, well, I was also going through divorce. Like my divorce happened just shortly after my accident. So tap that into that
Yeah,
piece of
no
it.
big deal.
And I was the crazy one. So I feel like it was probably several years after, maybe even 5 years after my accident, that I was just like, I'm okay. Like where I am is just fine. And I don't need to pretend like I'm not.
Yeah.
I don't need to act like I'm anything else. You know, I lost a lot of my vocabulary. That's another fascinating thing that I thought was interesting after my brain injury, that my vocabulary is shot. And like seeking and finding words is almost like next to none now.
Yeah.
But it probably really was, I'm going to say maybe 5 years after the accident, where I was just like, this is me and it's fine. And I'm okay with it. And I'm okay, like, audibly saying, well, now my brain is officially done. My kids are used to hearing me say that, too.
Yeah.
Or, well, guys, my brain's shutting down, so this is where I'm at.
Yeah.
And the day's done.
And I think that's an important piece. You know, we talk about it being an invisible thing, right? It's not something that people can look at and see. If someone has a broken leg, they've got a cast on their leg, they're walking with crutches, it's visible. It's okay.
Yeah.
You know, somebody goes through cancer, they lose their hair, we see that, and we automatically give them a pass for whatever they have to be excused from, right? But when someone says, I'm dealing with this, I'm glitching, my brain's done, there's still this stigma,
Yeah.
right?
Oh, yeah.
And I don't think it should be there.
No,
I was
yeah,
having a
for sure.
conversation with a friend recently that, and I say it shouldn't be, like, who am I to say that, right? But physical health and mental health, like, it's the same thing. If you have a cold, you have a cold. You can't just say, well, it's all in your head. No, my nose is running, and like, I have a cold. I'm exhibiting the symptoms, right?
Yeah.
But yet, we think about it in a slightly different way when it comes to brain injury or mental health. And somehow we've got to move past that. And
Yeah, well,
hopefully the conversations start to move us in that direction.
I hope so, because
right?
everyone only looks at the stuff that they can actually visually see,
Yeah.
right? Then they can identify and label, which is why I loved that you were saying that so much, because I wholeheartedly believe that all labels should be removed.
Yeah.
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 Because you can't really label it, right? And how you feel, you feel. What you're experiencing is your own experience. That's like saying to somebody that has never been to the top of a beautiful mountain on that perfect day, what that looks like and what that feels like. You're never going to experience that
No.
from words alone. Even if I painted a picture, you couldn't experience it. Right?
No. It's
You
like
just
trying
have
to take a
be
picture of a
there.
sunset.
Right.
Yeah.
That
It's
I
never
do.
the
I
same.
sit there and try to do a bazillion times while I'm in Costa Rica.
Never turns out.
Yeah.
It's never as amazing it is when you're in it, in the
Yeah.
experience itself.
Yeah.
You know this because you know Danielle well, but my wife has this thing where when something is cool happening, she says, come and see it right now. Like she just we have this joke where it's like we have to experience it together.
Yeah.
If there is a moon out there, it's like we gotta stand right there. We gotta
Yeah.
see it together. See, like that's the joke. See,
Yeah.
but it's not about see. It's like we're experiencing it together.
Right.
And that's because I could tell you about the moon. I could tell you what the sunset looks like, but
Yeah.
you gotta experience it there.
Right.
And the one thing I want to add to that is experiencing it together is not something that a traumatic brain injury patient is used to, because they're used to being so alone and isolated. They don't talk about it. And part of, when we're talking about acceptance, right? You know, Maslow's hierarchy of needs. I mean, our ultimate self-actualization is to belong, right? To know and be comfortable and to find people, right? And that is what I think is so valuable with this, is I'm hoping that at least one of your listeners goes, oh, that's me. I've experienced this. Wait, there's other people like me. There are communities like this. We have amazing communities like the Brain Injury Alliance. There's a community of traumatic brain injury here in Utah. At my clinic, we have a postgraduates, Facebook group and community in the Netherlands. You have 3 different communities that involve brain injury and cognitive effects. And true healing is acceptance, not just of yourself, but knowing that you belong, and other people experience that with you in that exact same way, and you are not alone. And so I think that, when we talk about healing, that is a big, huge piece in helping these people feel more whole, not just physically, not just neurologically, but psychologically and emotionally.
Yeah, I love that. I think Maslow's hierarchy is pretty fascinating to me. The only thing that I would say I would disagree with him on, and again, who am I to disagree, is not that it's this, at the base level, we're here, and then eventually we get to self-actualization. We need empathy along the whole process. We need to be able to become actualized while we are working on some of these other things. And so I don't think it's this linear path that we go up this hierarchy. My experience has been that it is almost cyclical or spherical, right?
And
you go all the way around.
Go up and down
right?
throughout it, absolutely.
And so I think that, if somebody says, well, but I still have this pain and I've got to deal with the pain first. No, get the empathy, because the empathy almost has this reverse effect. When you feel empathy from another human being, you now start to heal in a different way, because it's okay for you to show up in your most authentic way, right? I don't know who it was, but I read this quote probably 20, 30 years ago. It said that, outside of food and water and sleep, that the number one human need, most important human need, is to be understood, right? We just want to be understood. Doesn't necessarily mean we're right or wrong. We just want to be understood. And being understood when you are in pain is probably the most important step. So I love that you're talking about, you've got to have a tribe around you.
I do feel like that touches on like an element of brain injury that goes unnoticed, which is the friends and family of a brain injury survivor, because they're going through it with them. Like it affects everybody.
Good point.
And, you know, to have community in that sense too, that the friends and family have support of this, of their loved one changing, because that creates a lot of isolation and labeling and difficulty in healing or acceptance or hope and all these other factors that we've discussed.
I'm glad you said that, because my kids were literally traumatized from my experience. I wasn't their mom, right? It was completely different. Well, one, I wasn't awake for a little bit, but when I was, then I wasn't the one they remembered.
Yeah.
And they still talk about that. At least my daughter was talking about it not too long ago, on what that was like for her.
Yeah.
And I was so out of it
Yeah.
that it wasn't something I could really be aware of at that time.
Yeah, that's even for kids, that's got to be an extremely difficult experience to go through. But you know, partners and other family members, I think there's an opportunity to show up and to be there. You know, if you know somebody that has had that, to learn more about it, to understand it, so that you can have this empathy. Because if you've got the wrong glasses on, you got the wrong paradigm.
Yeah.
You're going to go into that interaction with a totally different perspective that may be,
and adding that into the package of healing,
negative.
it's a connection of healing together. Your friends and family, your loved ones, have to heal their way also with you. It's a joint effort.
I would have loved if people understood what I was going through. I would have absolutely have loved that, so that people could just sit and allow and support in a different way, rather than be like, why aren't you functioning normal? You look fine. Yeah. Come on.
Yeah. What a that's a call for family, friends to kind of open up.
Please. I think that, I love that you brought that up, because I think that's that would be so amazing for those that are going through, have been going through, or in the very beginning stages of it, to have family really understand what it is, and then have the support for what they're experiencing with their loved one.
Right.
Yeah.
Yeah. Well, and we hope that today we've brought some awareness to our listeners. We hope that today we've provided some education and some awareness that will help our listeners to understand this more. But I know, Dr. Fong, with your clinic, you provide a lot of education, you help a lot of people. And then Ashley and Dr. Fong, you sit on a couple of boards, right?
Yeah.
Tell our listeners a little bit more about where they can get information and why you're a part of the board.
Yeah. So the Brain Injury Alliance of Utah, our website, biau.org, there's every pop-up window possible to put your info in and connect with us. We have a phenomenal resource facilitation team that works so hard every single day to connect those that reach out to us with resource opportunities throughout the community and places like Cognitive FX. There's so many different options. I think one of the biggest things we're working on right now is the awareness that we exist, that, highlighting brain injury, highlighting that it's a part of our society and world and people's lives, and that we do have these organizations that can aid in creating hope and healing and opportunity and things like that. So we have an event this Saturday, actually, March 11th from 12 to 3 that we're hosting to try and build awareness, our portrait party in downtown Salt Lake City. That's on our website. It's on our social media. So just creating community and awareness like this.
Please come.
Yes, we have helmet giveaways. We have lots of free helmets. We actually have some raffle prizes, one of them being
a scan, not a functional MRI, but a structural MRI.
Okay.
So, Cognitive FX. There's a beautiful portrait party with one of the most incredible and talented photographers that founded Dear World is going to be there offering his services of people being able to show their story through their portrait.
Yeah.
So.
Yeah. I love that as an artist.
I was going to say that's
that
right up
part
your
of
alley.
it just really resonates with me, because I think art is everything, right? And
Len,
being
you
able
should be
to
there.
share your story. So that's phenomenal. And Jen, you do amazing work with people from all walks of life.
Yeah.
Tell our listeners a little bit more about how they can get a hold of you if they've got questions or they want to learn more about the quantum mindset and the trainings that you do.
Yeah, I always say the easiest one because it's easy to remember. Jenny Does Yoga on Instagram.
It's
I feel like
it's
that's
one of my favorite handles. there's several good handles out there, but that's one of my favorites.
JNNY, Jenny Does Yoga. And I think that is one of the easiest ways to reach out to me. Any questions, even if they reach out to me, I can help guide them in this direction as well. All I want to do is at least help one individual, right, here and there, and create a little ripple effect so people can live.
Yeah.
And I want to thank you, Jen, for being here with us and like sharing your honest story. I think it highlights hope to so many people because, you know, as we add this stigma of like the invisible injury, I mean, if you look at Jen, you're like, she's doing great in life. She's beautiful. She's perfect, you know, and you know, I think you are such a wonderful example of this to so many people.
Oh, thank you.
So thank you for that vulnerability and
thank
sharing
you.
and being here.
Thanks for thinking of me. I mean, I'm glad that you said that because if I can be some sort of like beaming light to people that are suffering, to see that there is a different way of being, you're not stuck, right? There is a way out. And there's obviously a panel of us here sitting right here that can help in some capacity. Yeah. Yeah.
Well, and I think, and I would echo what Ashley said. Thank you for coming and sharing your story because I do think that it opens up conversation and it opens up perspective because to Ashley's point, we live in this world where we see other people and we see so many people every day on social media that we can look at and we can make a judgment and say, they're good. They're good. Yeah. Wow, I want that life. And yet they don't know the challenges that you're going through. And so putting those things out there to say, hey, here's what I'm going through, then people can relate because they're going through something similar, right? So, I appreciate you sharing your story and coming on and having this conversation with us.
Thank you.
And Ashley, thank you for the idea. Thank you for bringing this whole thing to fruition. I can't thank you enough for the creativity and being the coordinator, right? Gladwell talks about that there are connectors and salespeople and mavens, and you're definitely the connector that brought everybody together today. So thank you for that.
Well, kudos to Dr. Fong. Like, honestly, the fact that you have a place for people to come together and feel like they have a tribe and not feel alone is powerful.
Very much
You're
so.
going to be next, right?
You know, I'm like, yes.
You come in?
Yes.
We'll see what's
I'll even document it on my social media so everyone can see what's going on.
Let's do it, and you can show them what an fMRI is really
I for sure would. I would document the whole
I
thing.
love that. Yeah, doing it live. Yeah, Dr. Funk, thank you so much for coming and sharing your knowledge. But I've also got to say, you know, allopathic medicine is a very strict way of doing things, and working with HMOs, I understand that business very well, and it is highly regulated and very difficult to make it in. My brother, who's a cardiologist, and I have had several conversations over the years and frustrations, with having to deal with and jump through all these hoops. And so when I meet a disruptor like yourself who says, there's a different way, and we're going to create something that no one else has done before, that is so inspirational. So kudos to you. Thank you so much for coming and sharing this. But more than that, thanks for having a mission in life to disrupt and to do something different, because it's people like you who will pave the way for many other people. I hope that 10 years from now, there are hundreds of clinics, thousands of clinics, whatever there needs to be, just like yours. But we know that there aren't right now. So it's going to take disruptors like yourself to evolve this particular awareness. So thank you for being who you are, doing what you do, and for coming on and sharing that today.
You are welcome.
Been an honor.
Welcome. It hasn't been an easy road, and it won't be easy, I mean, it is hard being a disruptor. You get a lot of hate.
Yeah, you do.
Oh, yeah, for sure.
You really get a lot of hate.
We can all,
I was literally told you're going to kill patients. Like they should be cocooned in a dark room. You're going to kill your patients. And I'm just like, whatever. That's
Good
not
for
true.
you.
You're killing them.
Like we say, we've said it many times on the podcast that the bigger the shadow, that means the bigger the light on the other side.
Yeah.
Right.
Thank you.
Well, and on that note, folks, it is time for us to wrap up another episode of the Evolve Podcast. I want to thank all three of our guests for coming on today. I think we've had an absolutely amazing discussion and our first roundtable. So thank all three of you for coming on and being disruptors here. We will put the contact information that we discussed in the show notes as well, so that all of our listeners can get a hold of you and ask any questions too, because I think that's an important thing. This should not be the end. This should be the beginning of the conversation. So remember, folks, just like Dr. Fong has done, and we talk about all the time, it takes time and consistency to evolve, but first you have to disrupt. And now it's time for you to get out there and evolve. Thank you for listening to this episode of the Evolve Podcast. Follow us on your favorite podcast app, and if you haven't done so, please give us a rating. As an independent podcast, it really helps us get more reach. This podcast is part of our mission to help millions of people evolve into the best versions of themselves. Please check out our coaching services at evolve-cast.com or pick up some of our Evolve merch. Until next time, keep evolving.